We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard.
We choose to do it, not because it's easy, but because it's hard. Our vision is within a decade, the trajectory of health will change.
Medicine is moving at such a fast pace right now.
Everything in medicine that we know now is going to change. Surgery, pharmaceuticals, well, now we're in the age of cells.
Cells will represent to doctors a much safer and more effective and sustainable way to treat all diseases that involve degeneration of tissue. So that's just about everything.
Exosomes will be very important in regenerative medicine because very similar to stem cells, they regenerate. They like to fix things.
That's what they do. They signal your tissues in your body to heal thyself.
Pope Benedict was very smart, and he really embraced science and how we can improve human health. The grand vision is to use cell therapy, stem cells, immuno-oncology using other cells of our immune system, natural killer cells, T cells, and then gene therapy.
What interested you about stem cells?
Oh, the technology is incredible. 15 years ago, I would have said this is science fiction stuff, and it's with us right now.
In vitro fertilization was considered a wacky idea. Now it's something that we use every day and we take it for granted. Soon we'll see the same thing with stem cell therapies.
It's a giant shift in thinking, in the concept of being a physician and a healer. And you can never just go back and say, I'm going to go back to my old life. I'll do surgeries, I'll write prescriptions. I can never do that again. I've already seen the other side.
5 years from now, majority of illnesses will be treated by stem cell, and any medical doctor coming out of any medical school must learn stem cell, otherwise they'll be left behind, period. We are a part of creating history.
Hi, I'm Dr. Brian Roadhouse, and I'm the clinic director of an amazing clinic in Tulsa, Oklahoma, Regeneration Nation. As a matter of fact, we've been doing regenerative medicine since 2016. And most people, the feedback that we get from my webinars and my in-person learning is one of the most information-packed seminars they've ever been to. And I'll give you an idea, just based on my experience over the years, like this little tidbit here. Do you know that when you get stem cells or any kind of regenerative medicine, if they preload it with lidocaine or anything that has cane in it, Novocaine, lidocaine, to numb the area to make the injection a little bit more comfortable, that those two products, anything with cane, actually kill the stem cells. So anyway, we're going to talk about a lot of things. You're going to learn a lot more, and let's get started so that we're going to teach you all about regenerative medicine. So today's seminar is going to talk to you about what you can do to help a lot of problems that patients have. Dr. Scott Johnson is our medical director, and he's an anesthesiologist, and he's been with us since 2016. That's our office. We are located, as I said earlier, in the Kelly Medical Building on the first floor. So if you've been in the Kelly Medical Building, you've walked by our office to get to the elevators, we're right there on the first floor. I'm also the co-author of the book, The Stem Cell Expert Secrets Exposed, The Ultimate Guide Before You Decide. So today is a day for you to be excited because we're finally going to have a chance to get you to feel better and the never-ending pain cycle and get your life back. Today is an opportunity for you to change your life. We're going to look at what's normal versus abnormal. We're going to show a knee because we have done probably more patients that have knee problems than any other joint, and I don't know why that is. Last year, we saved 96 patients that were told by orthopedic surgeons that they had bone-on-bone knees and they needed to have surgery. We were able to save them from surgery and get them back to doing the things they like to do.
My name is John. I had knee problems, really severe pain, had to walk stiff-legged, couldn't bend my knee. It hurt when I sat even. Went to the doctor and they x-rayed it, said my knees were bone on bone, and they recommended knee replacement. I didn't want to have knee replacement. I said take that ibuprofen. I didn't want to stay on ibuprofen forever. So I saw the Dr. Roadhouse's commercial on Facebook. So I watched the video, made an appointment to come and see him, and made an appointment to have my knees injected the same day. The procedure was very simple, no pain at all, a very small needle that they injected it with. I had trouble, I could not climb stairs at all, hardly. Well, stiff-legged. It's difficult to climb stairs stiff-legged. Since I had the shots, I've joined the gym. I started going to Silver Sneakers, and my knees have improved tremendously. I climb stairs with little effort now, very little pain. I walk on the treadmill at the gym. They've just been doing wonderful since I've had them injected. Life-changing.
So my name's Todd. I was sent here by my employer. I was sitting at home for like probably a month. I thought I had my left shoulder was injured. I was having like a lot of pain in my left arm, and my fingers were going numb, my left hand. And I came in here 2 months ago today and got a stem cell injected in my neck. I found out through an MRI that I had 2 degenerative discs in my neck that was causing nerve problems. Like I said, it's been 2 months and it turned out great. Getting the injection was simple, took no time, no pain. It was great, and that's it.
On the left-hand side here, you see the ligaments, and you're seeing some muscle tendons. On the right-hand side, you're seeing the bone, the femur, the patella, the tibia, the fibula. You're seeing the meniscus, the anterior. These are all cartilage and ligaments inside the joint. You want to know a big reason as to why people have to have regenerative medicine or leads them to a knee replacement? It's because you've had some kind of an injury to your knee. Many years ago, when you had a torn meniscus, they would go in and remove part of the meniscus. The problem is that left you with a knee instability, and that accelerated the arthritis in your knee to make it there. It's more likely for you to have a knee replacement because that meniscus is gone. Regenerative medicine can help to regrow those tissues so that you don't have to have a knee replacement. Degeneration means to become worse over time. Degenerative diseases are those health problems that will get worse without proper treatment. Here are the big 3. Okay, the big 3 are the most common joints that are surgically replaced. And basically, when they replace a joint, if you get your explanation of benefits, you're going to see it's a surgical amputation. The big 3 are knees, number 1. Number 2, shoulders. Number 3, hips. So in this one slide here, it's showing the progression. On the left is what a normal knee looks like. On the left, you can see that it's wearing down. The joint spaces are smaller. You're getting extra white along the joint surfaces because it's rubbing and it's becoming arthritic. Here's the hip. You can see the normal joint space on the right space. On the right side there, you see the joint space narrowing. You can't see a clear demarcation of the top of the hip, the round knob, and the suction cup that it sits into for better explanation. This is the shoulder. You can see on the left-hand side a normal shoulder, and on the right-hand side you can see all the white in the joint space and how it seems like it's cramped. That's basically what they look like. Remember, problems only get worse with time. And unless you try something new, your problem is not going to go away on its own, especially when you have a joint problem. And this is, common sense, but, when you have symptoms, they're telling you something's wrong. So if your engine light was on, you wouldn't ignore the engine light. You would go, oh, something's wrong. You would take it to the dealership. You would investigate to find out what's going on. And that's the way it is with your body. Pain and limited mobility and weakness, those are all symptoms that something is going on with a joint, and we need to do something and figure out what's going on and what's going to be the best method of treatment for you to get you back doing the things that you love to do. So what are the options available? Well, I'm sure everyone here has had any kind of a joint problem. They're getting non-steroidal anti-inflammatory drugs. Those are Advil, Aleve. You've probably seen the Aleve commercial where, the person's there rubbing their knee and it hurts and they go, well, I take Aleve. Now I can go and jog and I can do the things I want to do. These anti-inflammatory drugs and pain analgesics like Tylenol, they help with the symptoms. What the problem is that you have pain and stiffness because there's a problem. So if you take a medicine to cover up the symptoms and you keep using it, it further degenerates it. So you might get some temporary improvement, but you have problems down the road. Prescription drugs, pain relieving drugs, You know, they all help with the symptoms, and a lot of our patients come in, do they get to the point where they aren't working more, so that's why they're looking for another option. But it does not stop the degeneration. Opioid drugs like oxycodone, fentanyl, they might reduce pain, but they have terrible side effects. And more people die from overdose from those two medications than people that are killed in auto accidents. Cortisone shots and pills are often prescribed. Steroid injections, you probably don't know this, but every steroid injection into the knee or the joint, whatever joint it is, increase in absolute risk of a total knee replacement or joint replacement by 9.4%. As a matter of fact, Mayo Clinic says that you are only allowed to have 3 steroid injections in that joint in your lifetime. Where we have patients coming in, they do 3 or 4 a year for several years. The problem is it is very damaging to the joint. It eats away at the bone, at the cartilage, at the ligaments. You can get spontaneous tendon rupture. There are all kinds of things. Steroid injections are good if they're used one time because you had an overuse inflammation, it took care of it. But to go and use them on and on and on is going to cause problems down the road. And ultimately, it's going to lead you to either doing regenerative medicine, or if it's too far along, you're going to have no other choice but to do some kind of a joint replacement surgery. Studies have shown that when steroids are taken, cortisone, over 4 months, you can get 8% loss of bone. And if you look up on the Mayo Clinic website, they do talk about the dangers of it: osteoporosis, where the bone thins; osteonecrosis, where the bone dies; tendon ruptures. And you can only do the joint so many times like we talked about without causing further damage. Will you feel better today but actually have to pay for it tomorrow? And that's what happens when you use drugs to cover up the symptoms. The risk of surgery, I mean, obviously there's the anesthetic itself, there's bleeding problems, there's blood clots, difficulty breathing. There's 1 in 400 deaths 30 days following a total knee replacement. And then obviously there's increased use of narcotics, NSAIDs, and muscle relaxants. And this is all from the Journal of Orthopedic Medicine. It's time to do something about your joint pain. You know, are you feeling pain when there's rainy weather, prevents you from sleeping? Is it difficulty walking up or down the stairs, or maybe getting out of the bathtub? Do you feel decrease in motion, can't bend the joints like you used to? Do you feel grating or grinding in your joint? Have you been told you need to take long-term medications, joint injections, or told you need joint replacement surgery? Here's the stage of osteoarthritis. In the first one, there's about 10 to 20% of cartilage loss. The second one, mild, 20 to 30%. The third one, 40 to 50%. Any one of those 3 get excellent results with regenerative medicine. Once you get to stage 4, 60% of the cartilage is lost. You're going to have quite a significant amount of bone on bone. These patients still respond to regenerative medicine, but it'll increase the mobility. We will be able to replace some of the cartilage. You will be able to use it a lot better. You won't have as much pain. The problem is that there's so much damage that you might have to do the regenerative medicine again in about 5 to 7 years. When you use regenerative medicine, it has the highest upside and the lowest downside. So if you had to do it again in 6 or 7 years, at least you're not having to go through all of the problems that are associated with the total knee replacement. But ideally, we want to catch you in the first, second, or third stage. Knee relief injections. This is advanced arthritis relief protocol. Hyaluronic acid, maybe some of you have tried it. It is a temporary fix. The nice thing about it is covered by your insurance. It has been around for a while. The only time you're going to have a side effect on this is if you have an allergy to chicken or eggs, because they make it out of the rooster comb, and so some patients will have a reaction to that. So obviously we're going to ask you, do you know if you have any problem with an allergy to chickens or eggs? Most people know that. But basically what it does is it replaces the synovial fluid, which is the thick, cushiony fluid that's inside the joint. And it gives it cushion again, and it works good. It is a natural product, so your body does use it up and then it goes away. But the nice thing about it is you can have these done again. Some patients do good with this. Ultimately, this is a temporary relief that really doesn't have many side effects. It can help you put off getting a knee replacement. Regenerative means to, by definition, to bring back into existence, to regrow. So with the regenerative medicine procedures, you will not only be able to eliminate your pain, but repair, rebuild, and heal any of the injured area in your body. For example, if a lizard loses his tail, the tail grows back, and that's what we mean by regeneration, regeneration. Now just remember, when you were younger and you got a cut, you healed within 2 or 3 days. And if you're over 50, you know now that it might take, a week, 10 days, 2 weeks. Even if it's a bruise, when you're younger, it heals quick. And part of that is as we age, just like your hormones and everything else, your stem cell production decreases and you can't recover like you did when you're younger. You might be surprised to know that Stanford, Harvard, Mayo Clinic, Cambridge Stem Cell Institute, they all have stem cell institutes, and they are doing a lot of research, and it is just coming out that this is the wave of the future. The wave of the future is treat people with cells, not drugs, surgery, or medications. So now you have a choice. When we started doing this in 2016, before that, people didn't have this choice. They had to deal with getting anti-inflammatories, muscle relaxants, maybe pain pills. Then it progressed to the point where that wasn't working. Maybe they tried physical therapy. Then that wasn't working. So then they started doing cortisone injections. And basically this is all set up to prevent you from having a knee replacement. The whole time you're actually doing damage to the joint. And that's exactly where you're heading. Prior to 2016, you didn't have this choice. So regenerative medicine at our facility, we primarily offer different types of regenerative medical solutions. Platelet-rich plasma injections, mesenchymal stem cell injections, which also comes from amniotic membrane allograft, and umbilical cord plus amniotic membrane allograft. So, we were talking about these stem cells. And one of the things that happens is if you're going to get a stem cell injection, we need to find out if you're on any of this human biological medication. You might have heard of it. Humira, methotrexate, any of those class of cells. If you're taking those, we actually have to coordinate with your doctor, and you have to, if you want to do the stem cell treatments, you have to get off of those for 2 to 4 weeks because those medications kill stem cells. A lot of doctors don't know this, but because of our experience, I'm sharing that with you. Also, if you're taking a steroid injection, if you took it a month beforehand, we can do the treatment. If you took it last week, we need to at least wait 2 to 3 weeks because it's going to reduce the inflammation, and the inflammation is what tells the cells that they are going to replace those. So there's a mechanism in the brain that when there's a damaged cell, it sends a signal to your brain and sends all of your healing cells down to that area to help heal. If you're taking any kind of over-the-counter anti-inflammatories, a steroid injection, that signal's not going off, so they don't know, they will not go to the affected part. And by the way, there's nothing you can do, medication-wise, surgery, treatment, anything that can make those stem cells stay in that area. So we have to evaluate the patient and see where do we need to put the stem cells. Sometimes they come in with a really bad knee problem, but they also have a low back problem. You can't say, well, I'm going to do my knee, and then if that works, I'm going to do my low back, because the stem cells are going to go to your knee, they're going to stay there, but some of them are going to leave because of that signal, and they're going to go up to the hip. So your hip might feel better and your knee might feel better, but you won't get the full results. So we have to evaluate each patient individually. Platelet-rich plasma, this is a treatment that works really good if you have a minor problem, if you have any damage to ligaments and tendons that aren't completely torn. PRP is a component of your blood, and it's basically platelet-rich plasma, and you can see this schematic on the right-hand side, the plasma, that is the PRP, and it's all the healing cells. So you know when you cut your hand and you stop the bleeding and you look and you see that clear liquid, that's what that is. The problem is, as we age, we don't have as much of it, and if we put that into an area and we put 2 to 3 cc's, that's going to help with the healing process where your body can't heal itself, so it's an added treatment and product that we give you that can help you heal. They contain cytokines and all these health and healing growth factors that help with muscles, ligaments, and tendons. It's really fantastic. Most of the professional sports teams are using this rather than injecting. If you remember in the old days, if someone was injured, they'd numb them up with lidocaine and then they would give them a steroid injection. Now what they're doing is they're doing PRP and regenerative medicine. Common uses of the platelet-rich plasma is joints and muscles throughout the body, and it works really good. So, you know, how do you know if PRP is right for you? Well, if you've had a problem for longer than 3 months, that means it's chronic. Well, also, if it's acute, like we have a lot of athletes and they have a partial tear. You know, we do an MRI, we find they got a tear of a muscle, tendon, ligament, and usually what would happen, they'd have to put in a brace and they'd have to wait around and let the body heal itself. And obviously, if we put 2 or 3 cc's of this PRP into that area, it heals a lot quicker, usually in a week or two. That usually takes 10 to 12 weeks. So most of the sports teams are all using this. You know, if you've had problems in other areas, plantar fasciitis works really good with that. If you have any injuries to the muscle, and obviously, you know, we need to do an examination on you with and find out exactly what's causing the problem, because it might be sprain strain, but it could also be something a lot more involved. So we do a very thorough exam on all of our patients to make sure we know exactly what's going on so we can get you the best results. You can heal like the pros. We already talked about this. I mean, you can look it up on the internet, all the professional athletes. And, you know, the same thing goes, what we were talking about earlier, is they want to get the player, and obviously the player wants to get back into the game as quick as possible because they don't want to lose their spot in the rotation or on the team. So they are using PRP. As a matter of fact, University of Central Florida has got the NFL project where they are using PRP and regenerative medicine, stem cells, or amniotic tissue products. Are there any adverse reactions? Well, just like anything else, anytime you pierce the skin, it might be some soreness there. Anytime you pierce the skin, there's always a chance of an infection, but we look for that. And it's really one of the safest procedures that you can do. And you got to remember, on PRP, it's healing. Where you get a cortisone injection or a corticosteroid injection, it might help with symptoms, but it's actually doing damage. This is only the upside, no downside. Are there any contraindications? If you're on any kind of a blood thinner like Plavix or Coumadin, warfarin, we just have to make sure that you stay at the office after the injection for 10-15 minutes to make sure that the clotting occurs. And the FDA has approved PRP, and they're conducting research into how they can use this on other on other symptoms as well. So how long does platelet-rich plasma act? Well, most patients come in, they need 1 injection. Some patients, if they have a repetitive stress problem, like an athlete or a person at work or in your hobby, that you do the same thing over and over again using that same joint, you might need 2 or 3. It does create new tissue, and it helps to heal and cuts down on the scar tissue. So when you get done with PRP, the joint is going to be as close as it was, you know, when it was working at its best. And also, it can be repeated many times, so you don't have to worry about there's no side effects with it. So if you haven't, you go out and you're clumsy, or you're an athlete and you're doing a lot of trauma, or you've had just a bad stretch of luck where you've had 3 or 4 things happen, we can do this and there are no side effects, so it can be repeated safely, and it is one of the best things you can do to help heal the injury quickly without any drugs and surgery. So when it comes to stem cells, this is a chart here, and the first one is a newborn. So every 10,000 cells, you're going to have one stem cell. As a teenager, look, just going from a newborn to a teen, 11 years old, 12 years old, 13 years old, 14, it goes from one stem cell every 10,000 cells to one stem cell every 100,000 cells. And as time goes on, you can see once you get up 50, 60, you have one stem cell per 2 million healing cells that are in the air. So as we age, our stem cell production goes way down. That's why you don't heal like you did when you're younger. If you had a cold when you're younger, over 3 to 4 days, now it might be 2 weeks. The stem cells do the healing. There are a lot of different healing cells, but they're the most potent ones. So obviously, if you can get stem cells from the newborn, as in the umbilical cord, they're the most vibrant cells. They've never been used, and they have the highest success rate in regenerating tissue. There's types of stem cells. Actually, it's sources of stem cells. There are stem cells from the bone marrow. The bone marrow, they use a hammer, they use a cannula, they chisel through the bone, and they get the bone marrow. It is a painful procedure. If you've ever had anybody that had that done, it's very painful. And the success rate is based on how old you are. The bone marrow stem cells are best when you can get them from, in other words, if you have an injury and you're a teenager, that's when it's going to work the best. Same thing with adipose fat. Adipose cells, they do have stem cells in them, but obviously if you're 60 years old and you're going to use your own stem cells from bone marrow or adipose fat, you remember that chart that we just went over, you're only going to get one stem cell, but you get all these other healing cells, so you will get results. You just don't get the best results like you do when you get the umbilical cord. So the umbilical cord, they come from a healthy mom, healthy baby. They are donated, and they are the most vibrant stem cells. They are tested for every communicable disease. They make sure that they're safe, and they are the ones that, as the research has shown, you get way better results. Remember that chart. You get way better results than if you're using bone marrow and adipose. Some places are, some of the clinics across the country, they are using stem cells sourced from amniotic fluid, and placenta. The problem with those is they have a lot of debris in them. So they have to use an UV light to get rid of all of the debris that's in there. In so doing, when they use the UV light, it kills most of the stem cells. So the most of those in 1 cc, you might only be getting anywhere from 11,000 to 33,000 stem cells, or an umbilical cord, depending on the size, anywhere from 10 to 30 million stem cells. So cryopreserved amniotic membrane allograft, the different types. When you use the amniotic membrane, remember that they don't have a lot of stem cells in, but they do have high levels of growth factor. They have scaffolding, which lays the fibrinogen. So, I mean, it basically puts the layers like that. So it puts support in there. They have cytokines. They have lots of natural hyaluronic acid, and they have some stem cells. Remember, we just talked about 11,000 or 33,000. And it does help with pain reduction, elimination, reducing inflammation, minimizes scar, promotes soft tissue growth. But if you have a lot of damage to the cartilage or a lot of damage to the tendons and ligaments, you would be better off using the stem cells sourced from the umbilical cord. It is the gold standard in regenerative medicine. So they contain a high number of stem cells. They still include all the other factors that the PRP and the amniotic based stem cells have, and they do help with pain reduction, eliminating and reducing inflammation, minimizing scar, and promotes tissue growth, especially with cartilage. So today, all our stem cells, we've already talked about this. It's from an accredited Scientific Tissue Bank. It is governed by the FDA. They set the standards on how they store it and how they keep it. And the lab that we use does not use DMSO. DMSO is used in some of the preservative. It's a cryopreservative in some of the labs. But what we have found is DMSO affects the viability. In other words, the DMSO kills some of the stem cells. Also, we do not, the lab that we use does not use fetal bovine serum because that causes a damage to the stem cells also. So when you're looking at that, there are a lot of factors that you need to take into effect when you do stem cells. So here's an example of a bone-to-bone cartilage, and only after 8 weeks, you can see that the progress. That is the power of stem cells. You remember when we're younger, we get new cells. Inside the mouth, you get new cells every 24 to 48 hours. Liver cells take 7 years. Cartilage cells take 90 days to 180 days. Different tissue regenerates at different levels. So when you use regenerative medicine and the stem cells, they speed up that regenerative process. So what would take you, 2 months, 3 months, 7 years to regenerate, it does it in a much quicker fashion because you have these healthy, vibrant potential to improve the physical structure of the joint so much better. So our goal is to get you out of pain, get you back to function, get you back to going to, seeing your children's activities, your grandchildren's activities, doing the hobbies. Like if you like to dance or you like to travel, you haven't been able to do that. Not only do we get you out of pain, but we get you back where you can function again. It stops the degeneration and we help you to regenerate. And as you can see here, this is just different treatments. So you have the option on, and obviously you can see that a lot of our patients, they do PRP, they do allograft, and then some patients, depending on how much damage is, we do allograft along with, which is umbilical cord stem cells, along with the PRP. And the PRP is basically, just really accentuates and we get better results. And you have to remember that these stem cells are busy working and they're replicating every 24 to 36 hours over a cycle of about 65 cycles over about 90 days. They continue working up until a year. Now, as far as prices go, unfortunately, it's not covered by insurance. So the platelet-rich plasma is $1,500. The cryopreserved amniotic membrane allograft is $5,500. It works real good, but if you have a lot of damage, we don't recommend that. We would recommend that you go with a cryopreserved umbilical cord because it has the best results. And that basically is between $7,500 and $11,500, depending on the damage. If you have a lot of damage to one joint, or if you have a couple of joints that need to be injected. We have flexible payment options that fit nearly everyone. I would like you to know now at the end here, we're offering the most precious gift I can, and that's a chance to live a longer, happier, and healthy life. What we want to do is we want to get you back where you can do the things that you love to do. Whatever your hobby is, what you do for work, what you do just in your everyday activity. We want you to get up in the morning and go, you know what, this is going to be a great day. Instead of getting up and going, man, I'm having a hard time getting out of bed. I can't do a lot of things. My lifestyle has been really affected. What we want to do is get you back doing the things you want to do and just enjoy life again. So the next step is come into our office for a consultation. We want to make sure you're a candidate. We want to have all your questions answered. You come into the facility. We'll give you a tour. And if you want to move forward, the examination will be covered by insurance. Certain insurances do cover it, just like if you went to any other doctor. So if if you do have insurance and you met your deductible, then you just have to worry about your copay. If you don't have any insurance coverage, then the most it's going to cost you for the evaluation is $47. Now that doesn't include x-rays, MRI, or CT. So there are some cases we only need an x-ray, there's some cases we need an MRI, and if we do that, we can order that, and those will be covered by insurance. And if you have had any of those tests within the last 6 months or 6 months a year, and your symptoms have stayed the same, then bring those in with you on your appointment, either your x-rays or your MRI. If you've had an MRI like 2 years ago, and all of a sudden about 6 months ago your symptoms got worse, bring it in, but we might need to do another one, because if your symptoms have gotten worse, then probably the degeneration has got a lot worse too. But coming in for the consultation, if you call our office, that's going to be a no-risk consultation where you come and we'll sit down. If it looks like you're not a candidate or it's too far gone, then we don't go any further. We don't do the exam. We want you to be happy, and we're going to do the best we can for you. So I'm ready for you to come in and visit with our providers and see if we can't get you back to enjoying life again.
We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard.
We choose to do it, not because it's easy, but because it's hard. Our vision is within a decade, the trajectory of health will change.
Medicine is moving at such a fast pace right now.
Everything in medicine that we know now is going to change. Surgery, pharmaceuticals, well, now we're in the age of cells.
Cells will represent to doctors a much safer and more effective and sustainable way to treat all diseases that involve degeneration of tissue. So that's just about everything.
Exosomes will be very important in regenerative medicine because very similar to stem cells, they regenerate. They like to fix things.
That's what they do. They signal your tissues in your body to heal thyself.
Pope Benedict was very smart, and he really embraced science and how we can improve human health. The grand vision is to use cell therapy, stem cells, immuno-oncology using other cells of our immune system, natural killer cells, T cells, and then gene therapy.
What interested you about stem cells?
Oh, the technology is incredible. 15 years ago, I would have said this is science fiction stuff, and it's with us right now.
In vitro fertilization was considered a wacky idea. Now it's something that we use every day and we take it for granted. Soon we'll see the same thing with stem cell therapies.
It's a giant shift in thinking, in the concept of being a physician and a healer. And you can never just go back and say, I'm going to go back to my old life. I'll do surgeries, I'll write prescriptions. I can never do that again. I've already seen the other side.
5 years from now, majority of illnesses will be treated by stem cell, and any medical doctor coming out of any medical school must learn stem cell, otherwise they'll be left behind, period. We are a part of creating history.
Hi, I'm Patty Ritchie. Because I'm a two-time cancer survivor, I developed neuropathy pretty bad in my feet. And I thought there was nothing could be done, so I just kind of lived with it. But I saw an ad for Regeneration Nation. And I said to myself, I have all those symptoms. I'm going to give this a try. It can't hurt, and it might help. Well, I'm here to tell you it helped a lot. I have absolutely no pain. Neuropathy is almost all gone. I can stand up without falling. I can walk without wobbling, and my feet do not ache at all at night. The end.
Car accident, and I had fractured my knee bone and torn a meniscus. And I'd heard about stem cell therapy, and I was real skeptical about it. And I went to one of Dr. Roadhouse's seminars and was kind of impressed what I heard about it. So, I gave it a shot, and it's really helped me almost instantly. Like I said, I was very skeptical about it, didn't believe it. But once I've done it, I'm a believer now because it's helped my knee quite a bit, and I'm almost having to learn how to re-walk because I limped for so long in pain. I would suggest anybody to really look into stem cell therapy because it's really worked for me.
I'm Joella McNally. I started having some pretty bad back pain around the end of 7th grade. We didn't really know what it was. We didn't really worry about it. And then it just started getting worse and worse. And so we went to a few doctors, and we went through many x-rays. We had an MRI done, and they diagnosed me with a slight bulge disc and some degenerative discs. And we tried about 10 different types of steroid injections. We did spinal ablation. We did a bunch of physical therapy, and like nothing was working. And then I was referred here to Regeneration Nation, and after I got a stem cell injection, I started feeling better in a few weeks. I was out for over 9 months not being able to play softball, and that's what I want to do. I want to go to college. And it was just really hard not being able to do all that. And then when I finally came here, I started feeling relief, and now I'm back to playing softball, doing what I love, and it's a blessing.
Hi, my name's Ruben Markham. I came here and we've just completed 30 treatments, and I've probably got about 40% back in feeling in my feet, and my balance is much better. I'd recommend Regeneration Nation to anyone. At least give it a try. You don't have much to lose.
Hi, my name's Tracy Harris, and I come to Dr. Roadhouse for my knees because I do heat and air, going up and down ladders and kneeling all the time. And it was to the point of being unbearable. And after seeing a webinar on the internet, I thought this might be an option, so I come talk to Mr. Roadhouse. And we injected about 4 weeks ago, and because my knees were just, I couldn't bear the pain anymore, and the medicines I was taking, if they did help, they didn't help very long. And we come in, we got injected, and now here it is 4 weeks later, and I'm feeling great. I'd say 50 to 60% of my pain's gone, and I still got a few more months for them to do their work. And something I haven't been able to do in 15 years, I'd like to show you now. And I can now squat and stand back up without much pain at all. It's only been 30 days. And I would recommend anybody with at least knee pain to come and talk to Dr. Roadhouse.
Hi, I'm Ronnie Winsett, and I had stem cell injections done about 8 weeks ago, and it has drastically improved. I had another procedure done. I'd had extensive knee surgeries on both knees, and I'd had the adipose stem cell injections a little over a year ago, and it worked pretty good on my left knee, but my right knee, it didn't seem like it helped at all. And I'd heard about Dr. Roadhouse through my wife, who had the stem cell injections done. So I came with her to kind of see what he thought of the situation, since I'd already had stem cells, adipose, done before. And after visiting with him, he suggested that we do it and try it, and he felt like it would really work. The orthopedic surgeon that had done it before said it probably wouldn't be beneficial to me to do another adipose, because that was pretty much it. I was going to have knee replacement, which I did not want to go through. So I did the stem cells injections with here, and I'll have to tell you, before it was difficult to walk uphill or downhill, a little less up and down stairs. My right knee would just pop out of place, and very difficult, basically hand on the handrail if I was walking up steps, and same thing going downstairs, one step at a time, one step at a time, one step at a time. And here I am in 8 weeks, and I can actually walk up and down the steps without using the handrail, with like a normal person, just walking up up the steps and down the steps has greatly improved my mobility. And I would highly recommend talking to Dr. Roadhouse if you have any problems at all with your knees.
My name is Rusty Hill, and I've been with the Regeneration Nation for the past 2 months. My feet used to hurt all the time, like walking on needles. I had heat flashes when I was trying to sleep, and they just fidgety all the time. And since I've been here, I'm walking and feeling better than I have in the last 10 years of having this neuropathy. I look forward to some more treatments.
Okay, good morning. I'm Steve McGrew, and in my 4th week of having my treatment from Dr. Roadhouse, I was very skeptical. To begin with, I'll tell you how I injured my shoulder. I was helping a friend who had wrecked his motorcycle. We were loading it on a trailer, and I was standing up on top of the trailer and fell and landed right on my shoulder. And it's been bothering me this was last July, and the pain just wasn't going away. And I'm talking to everybody, and they had surgeries, and the surgeries, the rehabilitation process was just, and I know the surgeries are successful, but to me it just seemed like, there just was a long recovery process. And I, happen to see on Facebook, I'm in a motorcycle riding group. We have about 1,100 people, and one of the other riders kept posting about his knees, that he had an injection in his knees and what it was doing. And so I'd asked my doctor about doing stem cells, and he does the platelets. He takes the platelets out. He said, yeah, that stuff is very successful. So that kind of encouraged me to come and listen to the seminar and talk to Dr. Roadhouse. And after he went through and explained all the different types of procedures and how they harvest and where they get and the types of stem cells they do, I decided I'm going to roll the dice and do this. And it's just unbelievable. The first week I could already see results, and in 4 weeks I've got 95% all my rotation, everything. I still have a little bit of discomfort, and we're just barely getting started. It's going to, it's not going to get anything but better. But if any pain at all, a little bit. I'd say more a little discomfort still, but mostly it's healed. The words can't describe how well it works.
My name is Robert Gregory. I live here in Tulsa. Work for a nonprofit group, and before coming to Dr. Roadhouse, I'd been advised that I need a total knee replacement. I was bone on bone, and I certainly didn't want to do that. But the knee was getting really bad. Stairs were bad. Had to give up almost all physical activity. Was walking with a cane, and I just wanted to do anything other than the surgery. I was trying cortisone shots. They did nothing. I think they actually may have inflamed my knee a little bit. So I went to one of Dr. Roadhouse's seminars and saw the potential benefits of the stem cell shots. So I came and signed up for it, and that was simple and painless. It just took a few minutes. It was just, I think, 2 injections, one in each knee, and have been since then. Since getting the shots, I have not picked up my cane. I'm back at the gym, back on the elliptical, playing golf. Climbing up and down stairs with no problems. Haven't quite gone back to jogging yet, but I don't jog, so it doesn't matter. But it's been a complete 180 degrees for me, and I'm just so delighted to right now see my knee improving so much, and hopefully no more need for surgery.
Would you recommend us to anyone, Robert?
Absolutely, I would. It's too bad that insurance won't cover this procedure, which I know is a problem for some people, but you can spread that out over time. And as I think it was pointed out to me, when you look at your deductibles of getting insurance, you're really not going to lose any money by going the route of the shot. And certainly recovery, there's no recovery at all. There's no therapy afterwards like there is with the surgery, no risks of the surgery. So And Dr. Roadhouse has been great. He's been available with any questions I've had. He's seen me once a month since then, and I think I've been coming back in here in a couple more months. And so he's been great. So I would definitely recommend it. And I have been recommending it to my friends that have had similar issues, one with a bad shoulder and my mother with a bad back, and hopefully they'll come in sometime soon.
Hi, I'm Peggy. In 2016, while on vacation, I woke up with idiopathic neuropathy. I came home in a wheelchair. I saw many doctors over the next few years and was told there was nothing they could do. I'd just have to live with it. Then I heard about Regeneration Nation. Was I skeptical? You better believe it. Did I have my doubts? I sure did. But now I'm walking and doing almost anything I want. I can't tell you how it really works. Oh, it rejuvenates your nerves or stimulates them, but I don't know all the technical things. What I do know is I got my life back.
Hi, my name is Philip Bales. I had my first stem cell shot 4 weeks ago. When I first came into Dr. Roadhouse's office, I was in so much pain that I was about to see a grown man cry. And I had my shot on a Wednesday. 6 days later, I was pretty much pain-free with no pain, sleeping through the night. And it's been getting better every day since then. I have a little bit of pain when I first get up in the morning, a little tenderness, but I'm only on my 4th week of it. I would recommend this to anybody that's having back pain, shoulder pain, knee pain. It's been 100% blessing for me.
Okay, hi, I'm Ed, and I came to Regeneration Nation as a semi-skeptic, but having read and read up on stem cell injection, I thought it might be a good alternative for my knee. I tore some cartilage in it a little over a year ago in a hiking situation, and it never quite healed. It constantly hurt and ached and kept me from actually doing the things that I want to do as a healthy 75-year-old. And so I decided to go ahead and kind of gamble on this. And although I was hopeful that it would work, and I'm now just 4 weeks, a month out from it, and I probably have 75–80% improvement. I still have just a little pain at the side, but every day it seems to be getting a little bit better, and I'm very happy with it.
My name is John. I had knee problems, really severe pain. Had to walk stiff-legged, couldn't bend my knee. It hurt when I sat even. Went to the doctor and they x-rayed it, said my knees were bone on bone, and they recommended knee replacement. I didn't want to have knee replacement. They said take ibuprofen. I didn't want to stay on ibuprofen forever. So I saw the Dr. Roadhouse's commercial on Facebook. So I watched the video, called and made an appointment to come and see him, and made an appointment to have my knees injected the same day. The procedure was very simple, no pain at all, a very small needle that they injected it with. I had trouble, I could not climb stairs at all, hardly. Well, stiff-legged, it's difficult to climb stairs stiff-legged. Since I had the shots, I've joined the gym. I started going to Silver Sneakers, and my knees have improved tremendously. I can climb stairs with little effort now, very little pain. I walk on the treadmill at the gym, and they've just been doing wonderful since I've had them injected. It's life-changing.
My
My name is Deborah McGuire, and I've had neuropathy for probably over 15 years, and it's just gradually gotten worse and worse. And since I've come here and been taking the treatments, I've noticed a lot of improvement in my feet, and my left foot is almost, I can not feel a lot of numbness in it like I used to. It's still numb, but not as bad. And every time I have a treatment, it feels better and better. And I can start feeling, actually can feel hot and cold when I sit on hot concrete, which I couldn't before. So I believe this treatment has really helped me, and I would definitely recommend anybody to take the treatment if they're having any kind of neuropathy.
We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard.
We choose to do it, not because it's easy, but because it's hard. Our vision is within a decade, the trajectory of health will change.
Medicine is moving at such a fast pace right now.
Everything in medicine that we know now is going to change. Surgery, pharmaceuticals, well, now we're in the age of cells.
Cells will represent to doctors a much safer and more effective and sustainable way to treat all diseases that involve degeneration of tissue. So that's just about everything.
Exosomes will be very important in regenerative medicine because very similar to stem cells, they regenerate. They like to fix things.
That's what they do. They signal your tissues in your body to heal thyself.
Pope Benedict was very smart, and he really embraced science and how we can improve human health. The grand vision is to use cell therapy, stem cells, immuno-oncology using other cells of our immune system, natural killer cells, T cells, and then gene therapy.
What interested you about stem cells?
Oh, the technology is incredible. 15 years ago, I would have said this is science fiction stuff, and it's with us right now.
In vitro fertilization was considered a wacky idea. Now it's something that we use every day and we take it for granted. Soon we'll see the same thing with stem cell therapies.
It's a giant shift in thinking, in the concept of being a physician and a healer. And you can never just go back and say, I'm going to go back to my old life. I'll do surgeries, I'll write prescriptions. I can never do that again. I've already seen the other side.
5 years from now, majority of illnesses will be treated by stem cell, and any medical doctor coming out of any medical school must learn stem cell, otherwise they'll be left behind, period. We are a part of creating history.
So my name's Todd. I was entered by my employer. I was sitting at home for like probably a month. I thought I had my left shoulder was injured. I was having like a lot of pain in my left arm, and my fingers were going numb in my left hand. And I came in here 2 months ago today and got a stem cell injected in my neck. I found out through an MRI that I had 2 degenerative discs in my neck that was causing nerve problems. Like I said, it's been 2 months and it turned out great. Getting the injection was simple, took no time, no pain. It was great, and that's it.
Good morning. My name is Ron. I'm a 76-year-old man. Have been very active all of my life, and in a lot of fitness and athletic things, and became the oldest person with Parkinson's disease to climb Mount Kilimanjaro in Africa. So I've done quite a few crazy things, and along the way have developed some very major and very serious back problems. And I have progressed with that for about the last 10 years and got to the point where doing almost anything was very difficult and extremely painful. And I tried several different things with different types of doctors here in town. Never got any relief to speak of at all. And like I said, this has been going on for 10 years and getting progressively worse. It's to the point that at night my back would get hurting so bad I'd have to change positions in order to get back to sleep. And I'd usually have to get up and stretch for 2 or 3 or 4 minutes and get my back more primed and ready for some different feelings. And then I'd go back to bed, sleep about another hour, and be back up. So I was getting up 7 or 8 times a night. And talked to Dr. Roadhouse, and he mentioned how well this works and how good a candidate he thought I would be to have this procedure done. I was a little hesitant only because it's so new that we don't hear much about it or don't know much about it. And but I had to do something, and I wanted to avoid surgery if possible. So I came to Dr. Roadhouse, and he was excited to get a chance to work with someone that I think that had shared some of the problems that I had. And we started in, and I got the injections, and it took about 3.5 weeks for them to start working. I wasn't sure but whether I'd feel better the next day or when it would be. And he kept telling me probably between 4 and 8 weeks is when the majority of the people start noticing a difference. And sure enough, at about the 4-week mark, I got up one morning and realized I'd slept almost 3 hours that night without getting up, which really surprised me. And so I kind of felt around on myself and did a few moves that would normally have just brought me into tears nearly. And it felt a little better, and I reluctantly thought maybe it's going to work. So I noticed then for about the next 2.5, 3 weeks, every night I'd get up, and as I hit my feet to the floor in the middle of the night, expecting pain, it got less and less for about a 3-week period. And I haven't progressed much more than that, and that's been about 6 or 8 weeks now. So I don't know whether I'm going to continue to improve more, but I can't go hardly on percentages because it's hard to know how much pain you really had. But I know that I am feeling better than I have in probably a minimum of 5 years, and maybe even longer than that, and able to do so much more than I was able to do, and even just walking and sitting up and standing up and things like that were such chores. I stand up now, or start to stand up, expecting to get a big bolt of lightning, it felt like, through my back, and instead I stand up just like everybody else does. So I'm real excited about the future for the first time in several years. Getting old is enough of a challenge as it is, and especially when you enjoy being as active as I do. And I want to get back to that. I've had to give up a few things that I would like to get back to doing. So that's my story. I'm extremely excited, and as part of the fun is being involved in something that is new to Americans, that first to have this available like it is. And I'm very optimistic about not only my future, but people in general. It's a way that has not been available to us before, and the relief I have gotten has just been phenomenal.
Okay, hello, my name is Chris Victoria, and I'm back again for follow-up. And first of all, I'd like to say that Dr. Roadhouse is awesome. He knows what he's talking about. Number 2, range of motion. When I got to him, I was about here. Now I can do a full extension, no pain. When I got to him, I was about here. Pain, start crying out, I can go all the way past my ear. I can go straight up. These are things I couldn't do 3 months ago. Can work. Now I'm excited about my future because I might be able to work again. Angela, the practitioner, I was talking and I was kind of nervous about this big needle, and I was all digging in my fingernails, and I was waiting and waiting and waiting, and then she went in front of me, and I was like, okay, I'm ready. And she's like, we're done. And it was that quick and didn't feel a thing, just boom. And I can't even look at the shoulder before without it hurting. And she was in and out, and I didn't even realize it had happened. So if that's what you're afraid of, don't be, because she's really awesome. The whole staff is everybody, even the person holding the camera. Again, Dr. Roadhouse, you know what he's talking about. He's very patient. He's very awesome. And I suggest anybody that is watching this to take it seriously and really do it. It's worth it.
My name is Jack. I've had foot problems for probably 10 years. Never even considered neuropathy, and then I saw the advertisement for this and thought I'd try it, and it seems to be helping. My feet don't hurt as bad in the balls of my feet and such when I'm walking. So it seems to be working. Hopefully it'll be permanent.
My name's Matt. I had a high impact knee injury on my right knee and had a lot of troubles with going to the grocery store for more, or walking around in the grocery store for more than 15 minutes, and getting up from the couch, going to the kitchen, my knee would buckle on me, have to catch myself, going up and down stairs was a problem. So I came here to Regeneration Nation, had some stem cells injected into my knee, and I went from an 80% mobility in my knee to now 100%. That has changed my life quite a bit in these last few months, especially dealing with it for 2 years. How's that?
Hi, my name is Cheryl, and I came to Dr. Roadhouse for my thumbs. I've had arthritis in my thumbs for several years, and the doctors couldn't give me any prescription medication because of me being a diabetic, so they told me just take Tylenol arthritis, which was not working. And also was having problems with my kidneys. I would get up in the middle of the night, kind of crazy to say, but it was 4 o'clock on the dot every morning to have to go to the restroom. So my daughter-in-law and my son had this done for different areas, and I decided that I'd come and try this. They gave me injections in my thumbs, gave me I think what you call an IV push in my arm, and that was to try and go and attack, you know, the organs of my bodies. I've done the injections, I think it's 2 months ago. I've been here twice as a follow-up since then, and my thumbs are just, they do not hurt. They're still a little sore every once in a while. I can kind of tell you when it's going to rain, but the pain in my thumbs is nowhere near what it used to be at all. It's really helped. And the kidney function is, I don't get up in the middle of the night anymore, and I had gone to see my kidney doctor. She had done lab work, and so the time before the stem cells being done and then the time a month after, she called me and said, I don't know what you've done, but your kidney functions are so much better. They're so much improving, and I contribute both of my problems on my thumbs and my kidneys, the help from the stem cells from Dr. Roadhouse. So I would suggest if anybody out there is needing something done for pain, this is your place to go to.
Okay. My name is Jim Cook, and I just wanted to mention and be a testimonial, if you will, to the neuropathy treatments that I took here at Regeneration Nation. I've had hurting of the feet, neuropathy, for about as long as I can remember. In fact, at one time it was so bad that the sheets on my bed would give me a lot of discomfort to my feet. So I knew that there had to be something that I needed to do. I really never tried any other treatments per se that were regulated or anything like that. I just tried some creams and some salves, if you will. But when I saw this opportunity, I thought, well, I have nothing to lose. I'm in a lot of pain, and I wanted to give this a shot. I knew Dr. Roadhouse, and I felt very comfortable with Dr. Roadhouse and his group, very professional group. And so when I came in, I was explained the process, and that it would be a little bit of a process, about a 3-month process, twice a week, but it was definitely worth it. When I came in, they asked my pain level, and I was probably conservative when I said it was a 9. I didn't want to say it was a 10, or I thought they might kick me out, you know, that I was too high. But over the process of the treatments, it was mitigated and to about a pain level of about a 3 or a little bit lower as I concluded. Not completely healed, but extremely, extremely functional to where I don't have the tingling, the pain, the foot pain, the nerve pain that I had in early January when I started this process. I do a lot of golf and walking, so it's been a very beneficial treatment for me. And also I'm a docent and a volunteer at the Gathering Place, and I do a tremendous amount of walking there. So this gave me that opportunity to gain back my mobility, if you will. In fact, I walked 2 days ago at the Gathering Place when it reopened, a little over 3.5 miles, just visiting with people coming back for the first time. The process was very easy. The nurses were extremely professional. My appointment was at 10 o'clock. I got here at 10 o'clock and they immediately got me into the process, and I was always left within a 30 to 40 minute period. So it was just one of those things.
Hello, my name is Teresa, and I am a retired RN. I am 64 years old, and I actually retired in August. And the reason I retired was actually I was in a lot of pain. And I had decided that I was going to give up my nursing career and start taking better care of myself. I'm a patient of Dr. Roadhouse, and I met him through a seminar that he gave in Tulsa. I saw his ad on Facebook, so I went to the seminar and found about stem cell, and boy, I'm glad I did. So, to give you a little of my history, I had been diagnosed with osteoporosis. I had a fracture at the T6, and I had some very worn out knees from 40 years of very hard, long shifts at the hospital as a registered nurse. Actually 41 years. A knee surgeon here in Tulsa had done an MRI and told me that I needed knee surgery on my right knee, and that I probably would be having to get it on the left knee in the future. I had pain in both knees, but the right knee was much worse. I was living with pain. Every step I took, I was hurting, it was inflamed. I felt like I was walking bone on my right knee. So I retired nursing, and then I found out about stem cell therapy. And on August 17th, which is 9 weeks ago, I took the stem cell therapy. I got injections in both of my knees, and I got the IV infusion. And on the 4th week, I started noticing, I couldn't believe the change at week 4 in my knees. I mean, I was going up and down stairs without having to hold on and walk up the stairs like I was half crippled. And I was like, this can't be real. But it was real. And now I'm at week 9, and I am in 0 pain. I saw Dr. Roadhouse this past week, and my pain is literally gone. And the pain in my back where I had the fracture, it is also gone. I am just so thrilled and so thankful that I had the opportunity to get these stem cells. And Dr. Roadhouse has told me that this is just the beginning of my healing process, because what stem cells do is they help reduce inflammation, they help remove scar tissue, and then they are building new tissue where it needs to be built, and they help boost your immunity. So I am like feeling really great and so thankful, and anyone that has any kind of inflammation or pain in your body, I would definitely recommend you come talk with Dr. Roadhouse, and he'll discuss your case and see if he thinks that stem cells could help you. I know it has changed my life, and I'm very grateful.
We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard.
We choose to do it, not because it's easy, but because it's hard. Our vision is within a decade, the trajectory of health will change.
Medicine is moving at such a fast pace right now.
Everything in medicine that we know now is going to change. Surgery, pharmaceuticals, well, now we're in the age of cells.
Cells will represent to doctors a much safer and more effective and sustainable way to treat all diseases that involve degeneration of tissue. So that's just about everything.
Exosomes will be very important in regenerative medicine because very similar to stem cells, they regenerate. They like to fix things.
That's what they do. They signal your tissues in your body to heal thyself.
Pope Benedict was very smart, and he really embraced science and how we can improve human health. The grand vision is to use cell therapy, stem cells, immuno-oncology using other cells of our immune system, natural killer cells, T cells, and then gene therapy.
What interested you about stem cells?
Oh, the technology is incredible. 15 years ago, I would have said this is science fiction stuff, and it's with us right now.
In vitro fertilization was considered a wacky idea. Now it's something that we use every day and we take it for granted. Soon we'll see the same thing with stem cell therapies.
It's a giant shift in thinking, in the concept of being a physician and a healer. And you can never just go back and say, I'm going to go back to my old life. I'll do surgeries, I'll write prescriptions. I can never do that again. I've already seen the other side.
5 years from now, majority of illnesses will be treated by stem cell, and any medical doctor coming out of any medical school must learn stem cell, otherwise they'll be left behind, period. We are a part of creating history.
Yeah, I'm Henry Honus. I'm from Copan, Oklahoma, just 2 miles south of the Kansas line. Takes us about an hour and a half to get here. But my experience previously was a replacement of my right knee, and it was so painful and took so long with therapy and everything to heal that it was at least 6 months. And now my left knee is also the same way. It hurts all the time, even when I sleep. So I thought I just can't go through another surgery on this knee. So I looked for alternate sources, and I found the stem cell on the internet. I researched it, and I decided to come to the Roadhouse Chiropractor Services and check it out. And when I did that, he suggested that I have stem cells put in the knee to regenerate it. So 3 days later, I had it done. It took approximately 5 minutes to complete the insertion of the stem cells. And I walked out of here, and in a few days, I was able to sleep without pain, and I get out of bed and I could get on the leg and it would just be so much better. And now after 4 weeks, I have no pain. I could walk normally, and even my hip that was bothering me is not hurting anymore. So I would advise anyone that instead of doing surgery, to please check this out, because it's the source of God's own stem cell that heals you. And I look forward for you to come to the Roadhouse Chiropractor Services, and he'll tell you all about it. Thank you.
Hi, my name's Kurt Aldridge. I have had back problems for 20-something years. It's progressively gotten worse. In 2016, I had 2 back surgeries. They were laser surgeries for, what is that called? I'm drawing a blank. Sciatica, I'm sorry. And that worked really well for a while, and I started getting more shooting pains down my left leg, which I guess isn't sciatica, it's the nerve next to it, but didn't make me feel any better. So I saw an ad to come check out stem cells from Dr. Roadhouse. So I showed up and watched the presentation and decided to come try it. I've known about stem cells for a long time, so this isn't new to me. But finding a place that I could actually get them was awesome. So here I am at 8 weeks, and I'm probably 80% better than I started. Everything feels more solid in my lower back, which was, I actually got a shot, a CC in my lower back, a CC in my neck, and another one in my shoulder. In 2016, I also had a shoulder surgery that didn't turn out as well as I would have liked. But all three are feeling much better right now than before the stem cells. And, they just get better all the time.
Would you recommend this to anyone?
I'd recommend it to everyone who's, I don't know of anything that will actually build tissue. It's not like it's just repairing, it's actually creating new, which is awesome.
Thanks, Kurt.
Hi, my name is Mike. I've had neuropathy for about 3 months now with agonizing pain. I have been having treatments with Regeneration Nation, and after just a very few treatments, I'm without any pain. I can walk. It feels like I have a new lease on life, so I highly recommend Regeneration Nation.
Hello, my name is Chris Victoria, and I recently got stem cell injections in my right shoulder and in an IV push in the left arm, and my arthritis has gotten tons better. I had this shoulder injury, torn rotator cuff for 16, 17 years, and the pain was constant and unbearable, and these shots have really done the trick. It's unreal. I advise anybody who watches this to please take this into serious consideration, because it has helped me dramatically. I don't have to self-medicate. I can sleep longer. My whole life has completely changed. So if anybody watching this, I suggest that you think really hard and deep about this procedure, because it'll help you a lot.
I'm Joe, and in the last year I've had disc degeneration in my neck, the 4, 5, and 6 vertebrae, and I've went for MRIs and various doctors' appointments, and they've told me that the only way to fix and correct the pain, the discomfort that I'm having, and the numbness in my arm, and the weak disc where I can't even lift a gallon of milk, was to have surgery where they'd go in and place the hardware in there and basically fuse those vertebrae together. And I work at a place where they sent me over here to Regeneration Nation to look into stem cells, and I've been here now and received my injection, which was a quick visit, no pain, no surgery, no time off work or anything like that. And I'm back for my 1 month follow-up, and I am 80 to 90% better now. I sleep through the night. I have less tingling, almost none, in my hands and arm anymore. The strength that I need to work and conduct myself in the day is there, from pouring milk, carrying groceries, picking up children, tending the pets. I can do it all now, and that was gone a month ago, and prior to that, looking at surgery. So that's my testimony for Regeneration Nation.
Hi everyone, my name is Connie Lewis, and I live in Kiefer, Oklahoma. And I came to Regeneration Nation about 10 weeks ago with severe pain in my feet. The bottom of my feet hurt extremely bad when from a sitting position to rising. For instance, getting up in the morning, the first thing I stepped down, I would literally wobble, just hold and almost scream out. From past the 10, I would say at 20, but I've seen improvement in 10 weeks. I would say it's about a 7 now. It's certainly there, but it is doable. I mean, and getting better every day. I have felt periods of time during the day when I am walking, rising from the couch or the chair without pain. I'm actually walking in distances. I've started walking in April, 2 miles. That wouldn't have been possible 10 weeks ago at all. I had gotten to where it was so secondary, gaining weight, and just sitting, because every time I stand, it hurts. It literally hurts to take a step. And I do a lot of car driving. I drive as in my business outside sales. So when I'm driving and then I stand out, I have to stand there for several seconds, adjust my feet, and then take off and in pain. I'm in pain. So there's been a big improvement. I didn't know what neuropathy was. I tried every treatment, natural, of course, ibuprofen, different drugs trying to help the pain. And at least now I have knowledge of what neuropathy is. And, you know, that there is a chance that it will get better. So the nerves evidently do grow back. The staff people here are excellent. They take excellent care of you during the treatment. The treatment is painless. It's an electrical stimulation type treatment, and it actually feels good. I miss the days that I'm not coming.
Hi, I'm Chris. I've had 3 surgeries. I'm 50 years old on my knee. Ever since the first surgery, my knee has been swollen. I've been doing everything I could do to try to get the swelling down. Nothing really worked. Was on turmeric every day and stuff like that. My last surgery a year and a half ago, the doctor said that I would probably, the next step would be a new knee, so a knee replacement. Really didn't want to do that. Plus, at my age, you have to keep doing that. So I didn't want to go through just that entire cycle. So I sought out some alternatives, and I came to the stem cell treatment. I had that 3 months ago. The day after, most of the swelling had gone down that I had for almost 19 years. And then the day after that, the swelling was gone. My knee was, before the treatment, was, it just ached constantly, you know. And it got to the point where it was keeping me from doing the things that I wanted to do. So I was really hoping that this would work out and be able to get me back into being active and not hurting. And it has. It no longer aches. I mean, there was a continual ache. Now it feels good. It feels better than my quote-unquote good knee. So I'm looking forward to, you know, continuing the rehab and doing, being more active. Throughout my surgeries, I had a lot of the meniscus had to have been cut out, and so I was working with, you know, maybe half to a third of what I should have had. And so I didn't have a lot of cushion in there, and that was obviously causing the aching. And I feel much better when I walk. I feel like there's some cushion there now. It's not a chore to get up anymore. It still pops, but I mean, I think it's always going to do that. But I've really been pleased with the results, and I look forward to just what comes next, because it's been exciting to this point, and I would highly recommend it.
Hi, my name is Karen Allen. I'm a retired RN, and for years and years and years, I injured totally severed my left ACL when I was 15, and so I've had problems with that ever since, kind of thing. And as I've gotten older, more issues with it, and compensating with my right leg, the good one. I had an injury to it about 5 years ago that then made my right knee my bad knee. So I've really struggled with my knees, but in my years of nursing, I looked at, I saw so many people with scar road maps on their knees, and I knew that knee surgery, I really didn't want to go there if I didn't have to. And so it popped up on my phone for a webinar to look at for the Regeneration Nation. And so I looked at it and I watched the whole thing, and as a nurse, it made sense to me. as far as the whole process. So I came in and saw Dr. Roadhouse for a free consultation, and we did the stem cell therapy the next day. And I will tell you that my mobility was so limited that I thought I wasn't going to be able to do, like, to travel, to go see things, even to walk in a museum, to walk at all was painful in both knees. And I was really coming to my wit's end, is thinking that my life was going to be very not mobile, and that made me very sad. So watching the webinar, getting the stem cell injections, the exciting thing, I'm now 8 weeks into the stem cell therapy, and those little guys are just bebopping around my knees like you would not believe. And so at this point, I've been to Vegas, I've been to Colorado a couple of times, and what I'm finding is that probably my right knee, which was the most recent injury, is about 85% improved. I can walk and have no pain in my right knee, which is so exciting. My left knee that had more damage to it, I would say probably at this point is about 60% improved, which I'm really excited. I've still got about 6 more weeks of those little stem cells being at full throttle in my knees, so I'm anticipating that my left knee is going to continue to improve. A friend asked me the other day at dinner if I had the opportunity to do this all over again, would I do the stem cell therapy? And I said, absolutely yes. I feel like I've gotten better results than I would have gotten had I done the total knee replacements in my knees. As far as the mobility, I haven't had to go through the painful rehabilitation after post-surgery, which is awesome. And so I would highly recommend, and the staff at Dr. Roadhouse's office are awesome, so I'd highly recommend it.